This is the beginning of disc number 1 in the deposition of Sharon Craddock. This is in the matter of Kevin Tolson versus St. Agnes Healthcare Incorporated et al. This is in the Circuit Court for Baltimore City, Maryland, case number 24-C-12-008-071. Today's date is Tuesday, September 17th, 2013. The time is 11:16 a.m. Video operator today is Larry Newman, contracted by Merrill Lab Reporting. This video deposition is taking place at 901 Delaney Valley Road, Suite 400, Towson, Maryland, 21204. Would our counsel please identify themselves and state whom they represent?
Rodney M. Gaston, and I represent the plaintiff, Kevin Tolson.
Mary Pat McGuire, I represent the defendants, St. Agnes Healthcare, Inc., and Caroline Stell, RN.
Danielle Dinsmore, present on behalf of the defendants, Prudence Jackson, MD, Crocus Shaw, PA, and Maryland Provo 1 Medical Services, PC.
Our court reporter today is Peggy Dingle of Merrill Lab Reporting. Would our reporter please swear in the witness?
Ma'am, raise your right hand for me, please. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
Yes, I do.
Thank you.
Good morning. Could you please state your name and address for Baltimore City? The reason that I asked you to appear here today is because I received information that you may have provided care to Kevin Tolson when he was at the emergency room at St. Agnes Hospital on December 3rd, 2009. Before we begin, I'd just like to go over some of the ground rules so we can get through the deposition and have an accurate recording. During the deposition, even though it's being videotaped, the court reporter is here and she has to take down all of my questions and all of your answers. It's difficult for her to take down statements when both of us are talking at the same time. In normal conversation, it's usually really easy for people to anticipate questions and to interrupt each other. But so that we can get an accurate record, I would just ask that you wait until after I finish asking the question before you give your answer. Also, if at any time you don't understand a question that I ask you, please stop me and let me know, and I'll try to rephrase the question. Otherwise, if you don't do that, we will all understand that you've understood the question and you've answered truthfully. Have you understood everything so far?
Yes.
Anytime you need to take a break, just let me know. We can take a break.
Okay.
Have you ever had your deposition taken before?
No, sir.
Okay. Can you tell me a little bit about your background in the field of nursing, where you went to nursing school, where you got your degree?
I have a pre-med degree from University of North Carolina at Asheville. Graduated in 2004. I went to Johns Hopkins University and got my bachelor's in nursing, graduated in 2007, and I've been practicing as a nurse since then.
Okay. Have you ever practiced nursing in any other state other than Maryland?
No.
Okay. And when did you actually first practice nursing? Do you remember the month by chance in 2007?
August, maybe.
August of 2007?
Yes.
While you were at Johns Hopkins Hospital, did part of your nursing education involve clinical practice while you were in school?
Objection, foundation. You can answer.
I wasn't at Johns Hopkins Hospital. I was at Johns Hopkins University.
Right. While you were in school at Johns Hopkins University, did part of your nursing education involve you actually working in the field at a hospital or a clinic for part of your education?
Yes.
And where did that occur?
I did rotations at Johns Hopkins Hospital. I worked at Kernean Hospital.
And what type of nursing did you practice there? Can you tell me the unit or the floor or the ward and the type of patients that you took care of?
We did a psych rotation at Hopkins. We also did a pediatrics working with adolescent kids, mostly with respiratory issues. I've worked, you had to do a geriatric rotation, a mother-baby rotation that was at Sinai Hospital, and a public health rotation that was at Ruth's house, a battered women's shelter. Sorry.
House of Ruth?
House of Ruth, thank you.
Okay, thank you. Mhm. All right. Did any of your clinical education involve working in an emergency room?
Not initially.
Okay. And when did you become employed at St. Agnes Hospital?
October 1st, 2007.
Was that your first paid job as a nurse after becoming licensed to practice nursing in the state of Maryland?
No, sir.
Okay, what was your first paid job as a nurse?
I worked at Johns Hopkins Bayview as a critical care float nurse.
And for what period of time did you work there?
It was short. I worked 8 weeks. Part of my duties was to be in the burn unit, and then I had a family tragedy involving burns, so it just wasn't a good fit with me. So I left there for personal reasons.
I'm sorry to hear that.
That's okay. And then I found employment at St. Agnes.
Okay. And have you been employed at St. Agnes since October 1st, 2007 to today's date?
Yes, sir.
Okay. And have you always worked in the emergency room at St. Agnes Hospital?
Yes, sir.
Okay. And do you perform duties as a triage nurse at St. Agnes Hospital?
Yes, sir.
Okay. Is that the sole function that you serve at the emergency room, or do you perform other functions as well, other than a triage nurse?
Just, are we talking December 2009? I want to get some time frames on
Well,
questions around.
Yeah, if you can, I'll tell you what, why don't you explain the duties that you had at St. Agnes Hospital from 2007, October 1st, 2007, up to December 3rd, 2009, for that period of time.
I'm not sure I understand your question. Duties.
Do you not know what duties mean, ma'am? Your general duties as a nurse?
I was a staff nurse in the ER. Part of that was performing triage when assigned to that area.
Okay. So you did triage duties.
Right.
What other duties did you perform in the emergency room?
I'm going to object because I don't understand what you're asking. Are you asking for different roles that she played, or are you asking her to outline specific things that she did as a nurse? I think your question is unclear.
I just need to know what you did at the hospital.
She's just
I
told
cared
you.
for patients in the emergency room from admission to discharge.
Okay, from admission to discharge.
Yes.
All right, thank you.
Okay.
Okay. Did your duties vary from day to day? For example, was one day you were assigned simply for triage, the other day you were assigned to deal with patients while they were there? Can you
Yes, sir.
explain how did that break down?
You come in the morning and you look at the assignment sheet and you're assigned to an area, and that's where you work for the day.
Okay. Now I understand there's 3 types of departments in the emergency room at St. Agnes Hospital, is that correct?
Objection. You can answer.
There's a pediatric area, there's a main emergency department, there's a chest pain department, and there's an urgent care department.
And from October 1st, 2007 to December 3rd, 2009, were you assigned any one particular department at the hospital?
No, sir.
Have you worked in all of the different emergency room departments at the hospital?
I wasn't assigned to pediatrics.
Okay. So you worked in the urgent care, the main ER, and the chest pain unit?
Yes, sir.
Okay. Have you worked as a triage nurse in the urgent care, chest pain department, and main emergency room?
Objection. You can answer if you can.
Triage is not assigned to each unit. Well, there's a triage when you come in the front door. There's a
Right.
triage area.
Why don't you explain that to me? Go right ahead.
So if you're assigned to triage, your job is to stay at the front door and assess the people that come in. If they come in by the ambulance, then depending on what nurse is available, triages the patient.
Okay. I understand that some hospitals have a registration desk.
Mhm.
Is that the same as the triage nurse's duties, or is that a separate function performed by somebody else?
It's a separate function.
Okay, so when a patient comes in, do they first go to the registration desk where a clerk would take their name, address, things of that nature, and then they're seen by a triage nurse?
And again, all these questions are December of 2009. But
Yes.
And that's whether they walk in the door or come in by ambulance. Would that be a fair statement?
Yes.
And after the patient goes to the registration desk and gets registered, who prepares the hard copy, the chart, the actual physical medical chart? Who prepares that, and who puts the papers in the chart?
if you know.
The chart consisted of stickers, labels, and the assessment sheet. Usually you just grab the assessment sheet and later on they meet up with the stickers.
Trying to figure out who does that.
I can't say. It's just usually, hopefully the registration person will, they print out the stickers and hand them to the triage nurse.
And does the registration person get the hard folder and put the stickers on the folder and then hand it to the triage nurse?
Objection.
As far as hard folder, are you referring to that form right there?
No, I presume, does the medical chart, is there a folder that the papers are either clipped in or stapled in?
I can't say. It's usually just a paper clip, and then they're set in a designated area.
Is it like a manila folder or some type of hard folder that everything gets put into?
Objection.
At that time, I don't know what kind of charts we were using, but there was a place for them to go, a slot for them to go, so the physician could find them.
Right, that's what I'm trying to say.
Okay.
Was there some type of folder or item that all the assessments forms went into, so that when the doctor came by, a nurse could hand the doctor the chart so they could read the information that's inside the chart?
Objection to foundation and mischaracterized your immediate answer to the last question. You can answer it again.
Yes.
Okay, all right. Now, who would determine what forms went into the chart to be used by the nurses and doctors?
It was the same form for everybody.
And that's whether the patient was triaged to go to urgent care or the main emergency room department, the same forms would be in the chart?
Yes, sir.
Okay. All right. And do you remember where did you get your training and where did you learn how to perform triage?
You had to be a registered nurse in the ER for a minimum of a year. You had to take a triage class provided by St. Agnes with a qualified educator in the field of triage, and then take a test before you could practice triage.
Okay. So the earliest you could have been a triage nurse, according to your testimony, would have been October 1st, 2008?
Yes, sir.
Okay. Is that something that you volunteered for, or is that just something that you were expected to do as an employee at St. Agnes?
I can't recall. I wanted to do it, so I
You were-
asked to do it.
Okay, all right. And the triage class, do you know how long that lasted?
I believe it was an 8-hour day.
Was it a classroom instruction where you would sit in the room and we would be provided instructions by some other medical professional?
Yes.
And do you know the type of person that would give the instruction? Would it be a nurse? Would it be a doctor?
It was a nurse who was also an educator who her job was to travel the country and teach how to triage.
Do you remember her name?
I do not.
Okay. All right. And is she still at St. Agnes?
She was not a St. Agnes employee.
Okay. All right. And did they hand you a booklet, materials for the 8-hour class?
I don't recall.
The type of test that you took, was it a written test?
Yes?
I presume you passed.
Yes?
Okay. Other than the 8-hour class instruction that was provided at St. Agnes Hospital, did you receive any other specific instruction in the area of triage?
I don't recall. I don't think so.
Okay. All right. So you started triaging patients approximately October 1st, 2008?
That's the earliest I could have. I don't recall when I first did.
Okay. And can you tell me, do you have any recollection how many times you performed the function of a triage nurse before December 3rd, 2009?
I don't know.
Can you give me your best estimate?
Sharon, we don't want you guessing. If you have an estimate, you can, but if you don't know, then we don't. If you don't guess, we don't want you to guess. So if you don't know, don't guess.
I just need your best estimate. More than 100, less than 100?
Same instruction, Ms. Craddock.
I'll say many times. I can't be sure.
Do you know if it was more or less than 100?
I don't know. I'm
Don't
sorry.
know. Okay. And you know about, on the average, how many days a week, on a regular work week, prior to December 3rd, 2009, you would have the duty as the triage nurse?
Objection, asked and answered.
I can't say that either.
Is it 1 day a week, every other week, 1 day a month? Do you have any idea?
Objection, asked and answered. You can answer him again.
I don't recall.
Don't recall. Okay. Have your duties stayed the same since December 3rd, 2009 up to today's date?
Objection, don't answer that question.
Are you represented by an attorney today?
Yes, she is.
Is that you?
Yes, she
And you're
is.
telling the witness not to answer what her duties have been at the hospital from December 3rd, 2009 to today's date?
Yes, I am. Ms. Craddock is here as a fact witness for the triage assessment that she performed on Mr. Tolson on December 3, 2009. Her role, her duties, anything that she has done as a nurse after that date have no relevance or bearing to this, and she is not here in the role of an expert witness. So your question is inappropriate, and I'm instructing her not to answer.
Okay. So you have no idea, as you sit here today, how many times you worked as a triage nurse from October 1st, 2008 until December 3rd, 2009. Is that a fair statement?
Objection, asked and answered. You can answer it one more time.
That is a fair statement.
Okay. Now, did the hospital provide you with any written guidelines or protocols that you were to use or follow when you performed a triage for a patient in the emergency room at St. Agnes Hospital?
In December of 2009.
I don't know.
Do you remember them giving you any papers that contained any written guidelines and protocols that would instruct you as to how to triage a patient in the emergency room?
Again, in December of 2009.
No, ma'am. No, ma'am. The question is not limited to December 2009. The question is, from the time you became a triage nurse, the time you could have done triage, from October the 1st, 2008 to December of 2009, did St. Agnes Hospital provide you with any written materials, guidelines, protocols for you to follow when you would triage a patient?
Again, I'm going to object. I think your question is overly broad as you're phrasing it, because anything that would be pertinent to this would be things that were in place or in effect for December of 2009, and that's the error in your question. That said, if you understand, I'll allow you to answer the question.
At that time, I don't recall.
Okay. Ma'am, I've marked your notice of deposition as exhibit number 1 which I'll show council. And we asked you to bring with you, on item number 10, I'll read it, copies of any and all policies, procedures, and guidelines of St. Agnes Hospital that you followed for the care and treatment of Kevin Tolson, to include any and all documents that pertain to the triage of Kevin Tolson. Have you brought with you copies of any of those documents?
Objection, Foundation. I also am going to object on the record because we received this notice of deposition. I received this notice of deposition late Friday afternoon, which is certainly not the 10 days required or the 30 days required for any document production associated with the deposition notice.
I'll certainly be glad to continue the deposition to another date to allow you to comply with that if you're objecting that you didn't have enough time to get the documents.
It's not a question of my compliance, Mr. Gaston. It's a question of your compliance, and that is not a purpose to continue a deposition. Ms. Craddock, you can answer the question, if you recall what it was.
What was the question?
The question is this: did you bring with you today copies of any policies, procedures, and guidelines of St. Agnes Hospital that you followed for the care and treatment of Kevin Tolson, to include any and all documents that pertain to the triage of Kevin Tolson?
Object to the Foundation as well, but you can answer the question.
I saw this for the first time very recently.
Okay. The question is, do you have any of those documents with you today?
No,
Okay. Do you know if any of those documents exist?
I don't know.
Okay. And can you tell me what are the hospital's policies, procedures, and guidelines that you as a triage nurse followed when you performed triage of a patient in December of 2009 in the emergency room at St. Agnes Hospital?
Objection. She's already answered that question 5 different times that she does not know and does not recall, and therefore I'm instructing you not to answer that question again. This is just becoming argumentative at this point.
Okay. When you were taught triage as to how to triage a patient, do you remember what the instructions were? What you were supposed to do? How you were supposed to complete the triage assessment?
Objection to the form and to the breadth. You can answer if you're able to.
I'm sorry, are you asking me how I triage a patient?
Yeah, what were you instructed to do, and how were you instructed to perform a triage of a patient at St. Agnes Hospital?
Same objection, so you can answer if you're able.
You evaluate the complaint the patient presents with.
Okay, and how do you evaluate the complaint? What process do you go through?
You ask the patient what brought them into the hospital. You assess for any kind of injury and assess the validity of their complaint. And you do a triage physical assessment on the patient. And then you determine what place would be most appropriate to care for the patient.
When you perform the triage assessment, are you basing your decision on any standards that are set forth in the nursing industry?
Objection. I believe that question goes to standard of care. Ms. Craddock is not here as a standard of care expert witness, and therefore I ask you to rephrase the question so that I will allow her to answer it.
Do you base how you perform a triage on any recognized standards or any recognized published standards or guidelines by any organization or any professional association?
Objection, but you can answer.
I triage a patient based on my education, how I was taught, what I've learned over the years, and also what's expected of a prudent nurse.
Okay. Do you know if they're based on any written, published guidelines by any professional association?
Objection, you can answer.
I don't know.
Okay. And when you said your education and what you were taught, were you taught triage at Johns Hopkins University?
Not as a separate class.
Okay. Would it be fair to say the only instruction that you received from an educational standpoint on triage was the 8-hour class that was given at St. Agnes Hospital?
Objection mischaracterizes her prior testimony. You can answer.
I'm sorry. The question again, please.
Right. We're talking about, you said that the way you perform a triage is based upon the education and what you were taught. I think we established that you didn't get any specific instruction on triage at Johns Hopkins University. What I'm trying to find out is it fair to say that the only specific instruction that you received on how to conduct a triage and perform the triage of a patient was the 8-hour classroom instruction at St. Agnes Hospital? Would that be a fair statement?
It was how to care for and triage a patient was built into the classes at Johns Hopkins. There wasn't a specific class on how to triage.
Okay, and can you remember?
She wasn't finished, she just
I'm
said-
sorry, go ahead, ma'am. I apologize that I interrupted you. Go ahead.
That's
Okay.
okay. If you don't have-
Continue.
Okay, and can you remember from your education at Johns Hopkins University how you were taught to triage a patient? What that involved? Can you remember back that far?
You look for an injury and you evaluate the extent of the injury, and you determine the level of care that they will need.
All right. Are there particular levels or classes of triage? Does it go from, does it use a number system, 1 through 4, 1 through 5?
What are you referring to?
Well, when you assign a person a triage level, do you assign them a triage level of 1, 2, 3, 4, 5, A, B, C, D? How does that
You
work?
assign them a priority, 1 through 5, yes.
And where did you learn the priorities, the 1 through 5? Did you learn that
In the triage class.
in the triage class? Okay. And you've followed that instruction in assigning priorities to the patients that you have triaged at St. Agnes Hospital. Would that be a fair statement?
Yes.
Okay. And what type of injuries would qualify for a priority 1 triage level?
Priority 1 is dead or dying respiratory or cardiac arrest, or a severe chest pain that has a potential to be bad.
Okay. And how about a priority 2?
Priority 2 is somebody that needs to be with a physician in 5 minutes. So that is a stroke in the window, again, a chest pain with EKG changes, or somebody that's bleeding heavily, or something of those lines.
When somebody's bleeding heavily, could that mean both external bleeding or internal bleeding?
I suppose, yes.
All right. And how about a priority level 4?
Priority level 4 is somebody that needs one intervention. One intervention is a treatment that we provide. It can be an imaging, X-ray or CAT scan, MRI. It can be an IV medication, a breathing treatment, a splint, something along those lines.
Okay. So you try to determine how many interventions a patient might need. You total them up. And if the total is 1, they fall into priority level of 4?
Yes, sir.
If it's more than 1, then it would jump to the priority level of 3.
Yes.
Okay. So IV intervention is 1 intervention. Radiology study
Let him
is
finish before you.
is 1 intervention, correct? Okay, so we have radiology, we have IV. If a patient requires, you determine the patient requires a consultation, such as a cardiac cardiac consultation, a vascular consultation, or an orthopedic consultation, would all those be separate interventions?
Objection to form. You've got about 5 questions in there, and it also objecting to the foundation and scope.
Okay. Is a cardiac consultation considered an intervention?
Yes, sir.
Is orthopedic consultation considered an intervention?
Yes.
Is a vascular consultation considered an intervention?
Yes.
So if you determined that the patient needed all 3 of those, you would add them up 1, 2, 3, and that would total 3 interventions, and then that would raise it from a priority 4 to a priority 3. Would that be a fair statement?
Objection to form, foundation, and to scope.
You can answer.
Yes.
Okay. All right. When is the first time that you became aware that you would have to provide testimony for care that a patient by the name of Kevin Tolson received at St. Agnes Hospital on December 3rd, 2009?
I'm sorry, I missed your question. Can you repeat it?
When is the first time that you became aware that you would have to provide testimony for the care that Kevin Tolson received at St. Agnes Hospital on December 3rd, 2009?
I'm just going to instruct you, you shouldn't disclose any conversations you've had with counsel, so I don't understand.
I just want to know the date that she first became aware that she'd have to provide testimony in this case.
That I would be deposed?
That you'd have to provide testimony.
I don't recall.
Then you've answered.
I don't recall.
You don't remember if it was in the last month or 2 years ago?
Objection.
It was,
If you don't recall, you don't recall. If you don't know, you don't know.
Okay,
I don't
I
want
don't-
you guessing.
You don't have any recollection?
no.
Okay. When is the first time that you looked at any of Mr. Tolson's medical records from St. Agnes Hospital for his admission on December 3rd, 2009?
Let me just put something on the record here, Randy. I don't understand where you go with these questions, because I think all of this goes to attorney-client privilege. So I think that you need to rephrase these or restyle these in another format.
I didn't ask anything about attorney-client. I don't want to know anything that you and your lawyer talked about. I just want to know, when is the first time that you saw Mr. Tolson's chart from his admission on December 3rd, 2009? I don't want to know the circumstances or where you were or who you were with. I just want to know, when is the first time you saw his chart?
I believe it was this year.
Do you have any idea of the month?
I don't.
Okay. Do you have any independent recollection of triaging Kevin Tolson on December 3rd, 2009?
No, I do not.
Okay. And you don't know whether he's a white gentleman or an African-American gentleman?
I don't.
Okay. So the only testimony that you would be able to provide in this case with respect to a triage that you may have performed on Mr. Tolson would have to be based solely upon whatever notes were contained in his medical record. Would that be a fair statement?
In
Yes.
addition to her custom, practice, and habit.
We haven't talked anything about your custom, practice, and habit. So let me show you what's been marked as exhibit number 2. I have a copy for you. Now, can you tell me if your handwriting appears on any of those 21 pages? Please take your time and look through them. I want to be sure we don't miss anything.
Just the first page.
Only the first page. Okay. And what is all of the writing on the first page yours, or did someone else contribute to the writing on that first page?
That is all my writing?
That's all you're writing?
Yes.
Okay. And would this be the triage evaluation that you performed on Kevin Tolson on December the 3rd, 2009 at St. Agnes Hospital?
Yes, sir.
Okay. Now, when you write chief complaint, did you write leg trauma at work?
Yes, sir.
Okay. Is there anywhere else on the form that you can be more specific as to how Mr. Tolson injured his leg at work?
No, I can't.
Can you tell me, when you received that 8-hour instruction at St. Agnes Hospital, what were you instructed to do with respect to obtaining information from the patient as to how they were injured or what brought them into the hospital?
If they were brought in by a paramedic, you ask the patient what happened, and then you ask the paramedics to confirm that that's the injury that they saw or any situation surrounding it, and ask if you ask the patient what happened, and that's all they say, that's all they say.
Okay. Are you supposed to ascertain the mechanism of injury to the extent possible?
Objection, foundation.
Not if they won't disclose it.
Okay. Is there any way where in this report that you wrote that Mr. Tolson failed to disclose how he was injured?
Objection, foundation.
I'm sorry, can you repeat that question?
Anywhere on this form did you indicate that Mr. Tolson failed to disclose how he was injured?
Objection, foundation.
No.
If a patient refuses to cooperate with you and refuses to tell you how they were injured, do you then note that in the report?
Objection.
It depends.
On what?
Not being cooperative is different from not telling me how the injury happened. He was cooperative as far as saying, I hurt my leg at work. I think it can be ascertained later, the mechanism, to determine the injury.
Is that why you do or do not press patients for the mechanism of injury when you do an initial triage, because it can be determined later?
Objection to the foundation.
It's situational.
Do you know in this case whether once Mr. Tolson indicated he injured his leg at work that you believed that you did not need to obtain any more specific injury, more specific information regarding the mechanism at that time?
Another objection to foundation.
I'm sorry. Can you repeat that? I'm sorry.
Sure. Did you believe that once Mr. Tolson told you he injured his leg at work, that that was adequate enough for you to do your triage assessment of him?
Yes.
Do you believe that you did not need then to ascertain the exact mechanism of the injury in order for you to do an adequate triage of him at that time?
That's correct.
Did you also believe that there would be other opportunities later on through his course of treatment through the emergency room where other providers were going to ask him more specifics about the mechanism of his injury?
Objection.
Objection, form and foundation.
You can answer.
Yes?
Okay.
No, she's asking me if she can answer.
No.
That's what the yes was.
Yeah, you can answer.
I'm going to object to form and foundation
Okay.
as well.
Are you I'm sorry.
Do you want me to
Yes,
re-ask the question? Okay. Your lawyer said you can answer this. Let me see if I get the question right.
Let's see what the question is.
Right, it's going to be the
before I tell her
same,
whether
it's
she
going to be the
needs to
same
answer.
question I asked you before. Did you believe that there would be an opportunity for Mr. Tolson to explain in greater detail the mechanism of his injury to the other healthcare providers that would be treating him in the emergency room after you finish with his triage?
Objection to form and foundation.
Same objection as to the physician care.
You can answer.
Yes.
Okay. All right. Now, when you do a triage, do you conduct a physical examination of the patient?
No, you do a focused assessment.
Focused assessment?
Mm-hmm.
So would it be fair to say that you did not place your hands on Mr. Tolson's body to do the focused assessment?
No, that would not be correct.
Okay. Do you remember in this case whether you actually put your hands on Mr. Tolson's body to do the assessment?
Yes, I did.
Okay. What part of his body did you touch, and what were your findings?
So when you triage somebody, you ask them what brought them in. You try to establish if there was any kind of head injury or any major injury, or if it's an isolated injury. At that point, if you isolate it to the leg, then you do an assessment on the lower extremities, looking for differences in pulse, motor, sensory, color, and temperature. At that point, you're palpating both legs, asking them if they can feel it, if they can move it, checking for pulses, and making sure the color and temperature are equal.
Okay. And according to your note, you indicated there was a positive deformity.
Yes, I did.
Can you tell me where on his body you found the positive deformity?
That would be on his left leg.
Do you know what part of his leg?
I don't.
Do you normally write the location where you find the deformity, or you just write positive deformity?
Objection to form. You can answer.
It's deformity of the left leg. It's deformity of the body part in question.
Of the what?
Of the body part in question?
Okay, but the leg goes from the thigh down to the foot, correct?
Okay.
Okay. Do you know where on his leg you found the deformity?
No.
Do you normally put in your chart where on the patient's leg that you find the deformity, or do you just write deformity?
You just write what you see.
Okay, but from the note positive deformity, would it be fair to say that someone looking at this can't figure out what part of the leg is deformed?
Objection. I don't know how she's supposed to know what other people see or think.
Right. Well, can you see from your note what part of his leg was deformed from reading from your note?
No.
Okay. Is it important to note the location of the deformity in order to determine the interventions that may be required for the patient?
Objection. Foundation.
Not necessarily.
Okay. So if the deformity is at the upper thigh versus the knee versus the calf versus the ankle, that wouldn't make a difference as to the number of interventions you would believe the patient would need?
Well, it does, and that's what leads you to give them a priority.
Okay, so it's important to know what part of the leg is deformed in order to figure out how many interventions the patient needs.
Objection. That mischaracterizes
Yeah.
her statement.
Is that accurate?
For the triage nurse?
Yes.
Yes.
Okay. Do you know how many interventions you determined Mr. Tolson would need by the deformity to his leg?
I determined one.
Why did you determine one?
Because it was an isolated injury. There was no neurovascular impairment that I could determine from triage. I anticipated he would need an x-ray, maybe two, and that is why he was made a level 4.
Okay. How did you determine there was no did you say neurovascular impairment?
Yes, sir.
Does that include a neurological impairment separate and apart from a vascular impairment?
No, sir. Neurovascular is it's a part of the neurologic system, but it deals with the blood vessels and sensation in the body.
Okay. Does sensation have to do with nerves?
Yes.
Okay. And the blood vessels have to do with the vascular aspect, correct?
Yes.
So you have two of those combined to make a neurovascular impairment?
Objection to the form. I'm not sure I understand your question. So.
Neurovascular is the blood vessels and nerves that supply the body. They work together. It's not separate, they're together.
Blood vessels and nerves. All right. So a neurovascular assessment requires you to assess the neurological integrity of the leg along with the vascular integrity of the leg.
Objection.
There's things you evaluate to determine if neurovascular compromise is present.
And or one of those things, whether there's a nerve injury to the leg?
Objection. Scope.
I don't determine if there's a nerve injury.
Do you assess whether there's a nerve injury to the leg as part of your triage?
No, I do not.
Who would do that assessment?
Objection.
If you know?
I don't know.
Okay. When Mr. Tolson was unable, did you write here he was unable to move his left foot?
Yes, sir?
And did you reach any conclusion as to why he was unable to move his left foot?
Objection of foundation.
No, I did not.
Is one of the reasons a patient might not be able to move the left foot due to nerve damage?
Objection. I'm going to instruct you not to
I
answer
can't
that
say.
question.
Okay. When you wrote he was unable to move his left foot, what intervention did you consider in order to address that complaint?
Objection. Foundation.
Same objection.
And to the scope of nursing practice.
You can answer.
Hypothetically,
No, in this case, when you found that he was unable to move his left foot, what intervention do you believe was required in order to evaluate that complaint?
Okay, I'm going to object to the scope, and based on that question, I'm going to instruct you not to answer it because that goes to outside the scope of nursing practice.
I'm also going to object to the form in your comment that she found he was unable to move his leg.
Well, when you wrote he was unable to move his leg, why did you write that in the chart?
because when I asked him if he could move his foot or wiggle his toes, he said no, and I wrote that down.
Do you believe he was honest with you at the time you made that statement?
I can't say.
Well, I thought you said that you were required to assess the validity of the complaints, correct?
Objection
far-
to your terminology, use the word required. You can answer.
You,
Yeah, I think initially during the triage, you were going to assess the validity of the complaints, correct?
validity of the injury,
Okay,
yes.
okay. And when Mr. Tolson said he was unable to move his left foot, did you believe him?
I had no reason not to.
Okay. And when a patient tells you they're unable to move their left foot, do you take that into account when you determine their priority level for triage?
Yes?
Did you take that into account in this case?
Mm-hmm.
Okay. When you took that into account, you then have to determine whether or not, based upon that complaint, he needs an intervention, correct?
Objection.
It very well could be due to pain. So it still would not change how I prioritized him.
And why would it not change? If a patient tells you he's unable to move his left foot and you believe him, why would that not change how you would prioritize that patient on a triage priority level?
Objection, argumentative.
Same objections.
You can answer, ma'am.
Because aside from that, he had a normal neurovascular assessment, which is an objective finding as opposed to asking the patient to cooperate. And I triage based on physical assessment and objective findings.
Okay. And you said he had a normal neurovascular assessment. What findings or what reasons do you base that on?
He had equal pulses on both sides. The color was equal. The temperature was equal. And he was able to sense on both sides, me touching him. So the mobility was the only abnormal finding on my assessment.
Where does it say that you assess pulses on both legs?
Where it says positive pedal pulses,
Does it indicate which leg you check the pulses on?
you check them on both sides.
Okay. And do you usually put the pedal pulses in a strength from 0 to 4 on your chart when you assess pulses?
It's not necessary,
Do you usually do it?
not if they're equal and regular.
Not if they're equal and regular.
Yes.
Regular means what on a scale of 1 to 4 on pulse assessment?
Objection. You can answer it if that made sense to you.
The scale is 0 to 4 plus. He was a 2 plus out of 4 plus, which is completely normal. When it's normal, it's not necessary to indicate a 2 plus. It's understood.
Okay. Did you make any conclusion at the end of your triage why he was unable to move his left foot?
Objection to form and foundation.
And asked and answered.
No, I did not.
Okay. Did you conclude that he had a normal neurovascular assessment based upon the pedal pulses only?
Objection.
No, I checked the color, temperature, and sensory of the legs as well, both legs and the feet, prior to making that determination.
Okay. Do you remember doing this, or is this based upon your information in your chart?
This is based upon how I practice and what I wrote down.
Okay. Where does it write down that you checked the color?
I chart by exception, so I write down the abnormals. Anything not noted is normal.
You chart by exceptions?
Yes,
Is positive pedal pulse a normal finding?
it's a normal finding. I wrote it so that anybody that picked up the chart and saw a leg injury would know that it was assessed prior to finishing my triage.
But that's not charting by exception for the positive pedal pulses that you wrote on the chart, correct?
Correct, but it's
Okay.
She's still answering.
good
Finish it.
practice to note that he had normal pulses before sending off an extremity injury.
Is it also good practice to note that his sensory of his legs were normal as well?
Objection. That's argumentative.
Is that true?
I'm sorry?
Is it also good policy to note that he had normal sensations in his leg before you sent him off for
No.
other care?
No.
No? Okay. How do you know he had normal sensation in his legs?
Because I asked him if he could feel on both sides as you touch him. As you're checking for your temperature and your color and checking pulses, you ask if they can feel you equally on both sides.
Okay. But you don't remember doing that in this case. This is just based upon what you usually do, correct?
Objection. Terminology.
What I do with every patient.
Right. But you didn't write it in this case, correct? You didn't write it down in this case?
The sensory,
Right.
because it was normal.
Okay. Did you write down the color, make a notation of the color of his leg?
No, I did not.
And you didn't write the temperature of his leg, correct?
No, because it was normal.
Okay. All right. Yeah. What was his pain level?
7 out of 10.
Is pain level one of the criteria that you use and determine the priority for triage?
It can be used if it's usually based on how the patient presents.
What about in this case?
I would say no, because I didn't indicate on my chart that he was in agonizing, excruciating pain.
Do you believe he needed pain medication?
Objection.
Not IV pain medication, maybe oral.
Maybe oral pain medication?
Including Motrin and Tylenol, yes.
Is that an intervention?
No, it's not.
Why isn't oral pain medication not an intervention versus IV pain medications?
It's not one of the criteria that determines an intervention.
Pain is not one of the criteria?
No,
Uh,
oral.
Then there's the question.
Okay, is pain one of the criteria that determines whether a patient needs an intervention?
Objection asked and answered.
I did answer that already. Do you want me to answer it again?
Yes, please.
If the patient is in severe agonizing pain, and that may change the priority of the patient.
Okay. And on a scale from 1 to 10, where would you have to rate the pain scale in order for it to qualify as severe agonizing pain?
Objection.
It's based, each patient is individually assessed. It's not a number, it's how the patient looks and
Okay, so from this chart,
yes.
can you determine anywhere in this chart, setting aside the number that you picked
Mhm.
to describe his pain, what type of pain he was in?
He had some pain. He wasn't in enough to make him a level 3. So it was a moderate amount of pain, but it's to be expected with a leg injury.
But you didn't write anywhere in here the description of his pain other than 7 out of 10?
Objection to foundation.
Is that true?
That's true.
When you chart by exception,
Mm-hmm.
wouldn't you put in whether he had moderate level of pain, severe level of pain, high level of pain?
Objection.
We're asked to rate their pain from 0 to 10. If it's necessary to make a note about anything in addition to that, then that can be done. I did not make a note that he was screaming or anything that would make me want to raise his priority level.
If a patient had a complaint of pain 10 out of 10,
Yes,
but wasn't screaming,
yes.
you wouldn't raise his priority level from a 4 to a 3 or a 3 to a 2. Would that be a fair statement?
Objection. You're now taking her outside the case of Kevin Tolson. I think that's an inappropriate question.
I also object because it ignores her prior testimony.
You can answer.
It's not only based on what the patient says.
Well, what would Mr. Tolson have had to tell you in order for you to consider his pain something that would require an intervention?
Okay, I'm going to, at this point, instruct you not to answer these questions any further. He's clearly taking you outside of your testimony already with respect to your assessment of Mr. Tolson and taking you into the general world of other patients, which is not your purpose for being here today.
Okay.
I think the question also calls for speculation.
When you asked him if he was in pain, what did he tell you?
I can't recall what he told me.
And because you can't recall what he told you, you can't tell anybody that he wasn't in agonizing pain, correct?
Objection.
He rated his pain 7 out of 10. Pain is to be expected with a leg injury. It wasn't anything that was abnormal from what was to be expected at
Right.
the time of triage.
Yeah, but you don't remember how he described his pain other than a 7 out of 10, correct?
He didn't tell me.
You don't know whether or not he told you the pain is really bad, it's hurting me really bad, it's really killing me. You don't have any recollection of that whatsoever?
Objection.
He rated his pain 7 out of 10,
And what else did you ask him about that pain?
I can't say.
Okay, all right. And you triaged Mr. Tolson as a level 4?
Yes, sir.
Okay, what was the basis for selecting that priority?
Because he had an isolated injury with a normal neurovascular assessment. And I predicted that he would need an X-ray. And I did not see that he would be admitted, so I thought he was an appropriate level 4.
Okay. How did you check his sensory, the peripheral nerve in his feet, if you did?
We don't check peripheral nerves. We ask them if there's any sensory impairment, if there's any numbness or tingling, and if they can feel us equally on both sides.
And what, do you remember? You can't remember what he said when you, did you ask him those things? Do you know if you asked him those things?
I did ask him those things.
Do you remember that, or is that just based upon your practice?
It's based upon what I wrote and my practice.
Okay. But you don't know what his responses are because you can't remember what he told you, correct?
Objection.
I didn't write down any abnormals, so they were normal in my assessment.
Okay. And how do you check for sensory? I'm sorry, you don't check peripheral. How do you check for sensation in a patient's leg?
Objection to form. The question
Again.
is, how do you check for sensation? What's your question?
How do you check for sensation in the patient's leg in order to determine whether it's normal or abnormal?
In triage.
In triage, how do you check for sensation in the patient's leg in order to determine if it's normal or abnormal?
Objection to the foundation. I think objection to scope based on the breadth of your question. And it's already been asked and answered, but you can answer again how you evaluated his...
You touch them on both sides, and you ask them if there's any discrepancy between the two sides, if there's any numbness or tingling.
What part of the leg do you touch on both sides?
In this case, the lower leg,
What part of the lower leg?
from the knee calf down,
Knee, calf down?
from the calf area down.
kneecap.
Okay. Did he have his socks on when you examined him?
If he did, I took them off.
Do you know one way or the other in this case?
She just answered the question.
Do you know one way or the other in this case?
Objection to form.
Object to form, asked and answered. You can answer in the
If he did, I took them off.
And do you put the socks in a bag that goes with him through the rest of his course?
It depends.
On what?
Sometimes you just set it on them, and
He didn't put his socks back on his foot, right?
Objection.
I don't recall.
You have no idea? All right. Now,
Can I take a break? Do you mind?
sure,
Sure.
absolutely.
That's
That'd be great.
Sure, you
The
certainly
time
can.
is 12:19. We'll go off the video record. Time is 12:30. Back on the video record.
Ms. Craddock, for the notations you made in the chart of positive deformity, unable to move left foot, positive pedal pulses, was that the condition, was that Mr. Tolson's condition when he left triage?
Yes.
Okay. Can you tell me if you checked any other pulses other than pedal pulses?
Pedal includes dorsalis pedis and posterior tibial.
And posterior tibial is where?
It's behind the medial malleolus on both sides.
And where is the malleolus? Is that on the
Your
foot?
ankle.
Ankle?
Mhm.
Okay. And where did you actually conduct your assessment? Where physically in the hospital?
I can't speak. Probably emergency, like where the ambulances come in?
Yeah, that's what I'm trying to figure out. Was it done after he got to a room?
No.
Okay, so it's in the initial area where the ambulances bring the patient in.
Yes.
Do you assess him while he's still on the stretcher?
Yes.
And do you believe that that's where this assessment was conducted?
Yes.
Did you do an orthopedic evaluation?
That's not part of the nurse's job.
Okay. How about an orthopedic assessment?
We don't do,
Go ahead.
we don't, that's not part of the nursing triage.
Okay, so it'd be fair to say you didn't try to lift his leg up, you didn't try to do a flexion or extension, you didn't try to do the internal external rotation of his knee.
No, I didn't.
Okay. There's a signature on this page where it says triage RN signature.
Yes.
Is that your signature?
Yes.
Okay. Is that S, and what is the last name there?
Besche, B-E-S-C-H-E?
Was that your maiden name?
Yes.
Okay, thank you. And you have worked as a nurse in the urgent care department?
Yes.
Okay. The forms that are contained in this package, if you can go through them.
Okay.
Are those the forms that you have used as a nurse in the urgent care department?
Yes.
Okay. If you can go to page number 7.
Okay.
Can you just identify for the record what that is, please?
I'll ask her.
Okay, thanks.
Yeah, that's my next question.
Thank you.
Have you seen this type of a notation in a patient's chart before on the computer?
I still don't know what you're looking at.
Page 7 of the
You
exhibit?
didn't ask
I
about-
gave counsel a copy for the two of you.
That's not the point. The point is that when you're hearing and reading the transcript, you're not going to know what the page is. That's why she was, I believe, that's why Ms. Gilmore was asking you to identify the
Right.
record.
Okay. Ma'am, what are the documents that are before you? If you can just read the exhibit sticker that's on the front. Go to the very front page.
That's,
I don't know. I've never seen this
Okay,
one before.
if you can hand those back to me. Okay. This is exhibit number 2. Okay.
Okay.
I don't have an exhibit number 2.
I gave a copy for counsel.
well, you gave
If
it
you
to
wanna share.
one counsel. You didn't give it to both counsels.
Exhibit number 2.
We can resolve this if we could just say what the
Identify
name
what the
of the
record is
document
that you're
is.
asking her to comment on.
That's Mr. Tolson's medical chart from the December 3rd, 2009 admission. That's exhibit number 2. Okay. Now, we're at page 7 of that exhibit. Are you familiar with the documentation that's on this page from your employment at St. Agnes Hospital?
If you are asking, is she familiar with this form that is on page 7, which is titled Emergency Department Management Live Physician? Are you familiar with that form?
No, I'm not.
Thank you, Mary Pat.
Okay. You've never seen this before?
Nope.
Okay. Where it says arrival date and time, December 3rd, 2009, 15:22. Does that time refer to 22 minutes after 3 in the afternoon?
That would, yes.
Okay. Now, do you know what time you conducted the triage on Mr. Tolson?
No, I do not.
Were you required to write the date and time on the triage form that you filled out, which is page 1 of that exhibit?
Objection to the use of the term required. You can answer.
It's good practice, yes.
Do you know why you didn't in this case?
I don't.
Okay. Now, with respect to the emergency room, are there male nurses that work in the emergency room department?
Now?
Now, that's not an appropriate
Back on December
question.
3rd, 2009,
Thank you.
were there male nurses working in the emergency room department?
I believe so.
Okay. Have you discharged a patient before from the urgent care division of the emergency room department?
I have, yes.
Okay. Now, is there a particular person or group of individuals who if a patient needs to be assisted out of the emergency room, such as in a wheelchair, did you call and they then assist the patient from the bed to the wheelchair and wheel them out of the hospital?
I'm going to object. I think this goes outside the scope of this witness's testimony. She's already testified that the only place she was involved in Mr. Tolson's care is in triage. And now you're asking general practices regarding discharge.
Yeah, I want to know if there's people there in the hospital that assist patients and put them into wheelchairs and wheel them out of the hospital.
Not from the emergency room.
From the urgent care division?
If they request it, then it's possible, but generally if there's family present, they'll
Yeah.
assist the patient out. It
If-
depends.
And if it's not family present and someone in the emergency room, urgent care has to do it, is it done by a nurse, by a nurse's assistant, or by some other person with a different job categorization?
I'm going to object. She already answered the question that you previously posed, which was more than she really needed to do, so you don't need to answer that again.
Tell me the types of people that work in the emergency room, urgent care.
Objection. No, there's no time scope on that
December
question.
3rd, 2009. Let's go back to 2009 in December. What are the types of people that are employed in the urgent care division at St. Agnes Hospital?
Okay, well, you're not going to be able to answer that question because you asked about employment. I'm going to instruct you not to answer that. Ask for a legal conclusion or an occupational conclusion that she's not here to give.
Tell me the types of people who are employed at the urgent care department. Actually, not the type of people who are employed, the people who are there with you, who assist with patient care. Can you tell me the types, their categories, whether they're doctors, nurses, medical assistants?
Okay, I don't know that I was working in urgent care on that day.
No, but generally.
Generally, there's...
Okay, well, then I don't think that that's an appropriate question.
Yeah, I'm trying to identify the person who wheeled Mr. Tolson out, and I'm trying to ask this lady to identify the people who work in the emergency room so we can figure this out.
And she's already told you that she wasn't in urgent care that day and that she did triage. So she's not the person to direct this question to.
Tell me the types of people that work in the urgent care division. Are they nurses, doctors, medical assistants, orderlies that you've worked with in the past and in December of 2009?
Objection.
There's usually a physician assistant, and a nurse or two, possibly a tech. It depends.
Okay. Now, are there any non-medical persons, such as an orderly or someone of that nature, who has assisted patients in the emergency room, St. Agnes Hospital, in December while you were working there?
Objection.
Volunteers are not supposed to touch the patient physically, so that would not be in their role to push patient out.
Okay. So, if a patient needed assistance because they couldn't walk from a bed to a wheelchair, would it be fair to say it would have to be done by one of the following: a doctor, a physician's assistant, a nurse, or a nurse's tech?
Objection. Don't answer that question.
Objection.
If you needed someone to assist a patient off of a bed and into a wheelchair, and the family was unable to do it, who would you call to do that?
Objection. Don't answer that question.
Did you prepare any other writing on this medical chart?
Did I prepare? No, just the first page.
Okay. Can a patient's triage level be upgraded while they were in the urgent care department?
Yes?
Have you done that in the past?
That's not really a nursing decision. The triage prioritization is an initial screening. After that, if the patient needs to be upgraded, the physicians need to discuss that.
Okay. Now, can you go to page 7 of Exhibit 2?
Yes?
Okay. Where it says priority/severity 3/9. Do you know what those numbers stand for?
Hold on, objection. What page are you on?
7.
Okay, so this
I-
is the page you're not familiar with?
I
Okay.
don't know what that is.
Have you, before today's date, reviewed any documents in preparation for your deposition?
Yes,
Okay, what are they?
this packet right here. Exhibit 2?
Anything else?
No.
And to be complete and fair for the deposition, I did briefly review or show Ms. Craddock the medical record from this emergency department visit just to see where her name appeared. I don't know that she saw some of the pages, like the computerized pages that you were asking her about earlier. This is your exhibit 2.
Okay.
I've seen this.
Have you seen the actual physical hard chart from St. Agnes Hospital for Mr. Tolson's admission on December 3rd, 2009?
No, I've not.
Okay. Have you seen any videotape depositions of witnesses who have been deposed before today?
No, I've not.
Okay. Once you're finished with the triage assessment, where do patients such as Mr. Tolson go? What's the next step?
The triage nurse will call the appropriate unit and tell them about the patient, what their complaint is, and the paramedics will transport the patient to that area and move them to the stretcher.
Do you know how long your assessment of Mr. Tolson took,
I don't know.
based upon your custom and practice? Can you give me an estimate?
Objection again, don't guess.
That's kind of hard to say. I'd rather not.
Did you check all of his vital signs?
Yes, I did.
Okay, so you were the only person who did the triage assessment, correct?
Yes.
Do you have a resume?
With me?
Well, that'd be the next question. Do you have one, and do you have one with you?
I am in the process of updating mine. Do I have it with me? No.
Okay. If you're called as a witness to testify in the case and ask questions about the reasons that you performed the triage assessment and what actions you took, do you intend to rely upon any medical textbooks, documents, journals, or other documents in order to explain what you did in this case?
I'm going to object. I think that's an inappropriate question to this witness. She is here as a fact witness nurse. She's not here to talk about legal proceedings or trial testimony or any other thing. She will testify if called to trial as a fact witness.
Still need to know your answer, though.
I don't know if it will be needed.
I'm sorry?
I don't know if it'll be needed.
Well, is there anything, written document that you can think of at this time that you based the manner in which you performed the triage on Mr. Tolson?
Objection. You've asked her all of those questions during your deposition, and she has answered them. I think that you are now asking her questions as an expert witness, and I'm going to instruct you not to answer because you've already answered the questions otherwise.
That's all the questions I have.
just have a couple.
Okay.
Ms. Craddock, you were asked some questions by plaintiff's counsel about registration,
Okay.
and you said that that Mr. Tolson would have first gone to registration before triage. Is that correct? Do you remember that?
Yes.
Okay. What is that registration process that you were referring to in that answer?
So a secretary for the ambulances sits at the ambulance door, and as soon as the patient gets there, they generate labels, such as the one on the forms, with their name, medical record number, date of birth, and that only takes a second, and then that's called quick reg, really, and then the nurse can put a label on the chart.
Okay. Now, I'm going to show you this form that is contained in Mr. Tolson's medical record. It's entitled Emergency Services, St. Agnes Hospital, with the address of the hospital. Mr. Gaston did not present you with this page in his medical record exhibit, as far as I can tell.
Okay.
So I'm going to show you that and ask you what that document is.
Could we just mark it so that we have a record?
I will, but
Thank you.
I can't do it at the moment. What is that document?
This is the registration page once the patient is fully registered.
Okay. And does this information on this registration page happen always before triage, even if the patient comes in by ambulance?
No.
Okay. When can this information, this registration process occur?
At any point, really. Definitely before discharge, it has to be finished.
Okay.
But I don't know about a time limit.
Okay. So this formal registration process, which is on the Emergency Services St. Agnes Hospital page, this was not done before triage
Objection,
in Mr.
leading.
Tolson's case. Can you say whether or not
I
this was
don't
done?
know that it was done before triage.
Oh, okay. As a triage nurse in the emergency department at St. Agnes on December 3, 2009, do you order consultations?
No, I do not.
Okay. Would that include, do you order as a nurse or a triage nurse in the emergency department at St. Agnes in December of 2009, do you order vascular consultations?
No.
Orthopedic consultations?
Nope.
Would it be fair to say that, do you make any diagnosis to determine the need for such a consultation as a triage nurse or an emergency department nurse at St. Agnes?
No.
So I think you said a few minutes ago that triage is an initial screening process. Is that correct?
Yes.
Okay. Do you make any diagnoses in triage as a nurse at St. Agnes Hospital in 2009?
No.
Okay. Is that within your scope of practice?
No, it's not.
Can swelling be a deformity?
Yes, it can.
I'm going to direct you to page 1 of Exhibit 2.
Okay.
Did you ask Mr. Tolson anything about his medical history during triage?
Yes, I asked him if he had any medical or surgical history, as well as allergies and medications,
Okay, and how do you know that?
because he denied all of the above.
And did you indicate that anywhere or write that on the triage assessment form?
Yes, I wrote denies and no allergies.
Okay, and that's where the X next to NKDA is?
Yes,
That means
no drug allergies.
Okay. Okay. Looking in the next block down on that page,
Mm-hmm.
you identified, is that where you wrote your pain assessment?
Yes,
Okay. And that's where you indicated 7 out of 10?
yes.
Okay. How is it that you determined that Mr. Tolson had a 7 out of 10 pain level?
I ask people to rate their pain from 0 to 10, 0 being no pain, 10 is the worst you can imagine. Can you describe your pain for me? And that's the number that he gave me.
Okay. So on December 3rd, 2009, when you were triaging Mr. Tolson, you asked him those questions?
Yes.
And the number 7 out of 10, that was provided by Mr. Tolson?
Yes.
He told you that number?
Yes.
Okay.
Oh, boy.
Okay. Did you order any interventions for Mr. Tolson?
No, I did not.
And do you, as a nurse, order tests or consultations on the patient in the ED?
No, I don't.
Okay. Is that within your scope of practice?
No, it's not.
Do you, as a nurse, is it within your scope of practice as a nurse doing triage in the emergency department at St. Agnes in December 2007 to do an examination of the ligaments, tendons, or stability of a joint?
No, that's not in my scope.
That's all the questions I have.
Okay, we're gonna have to go off the record to change the tape.
Hold on a second. Time is 12:55 PM. We'll go off the video record. Time is 1:01 PM. Back on the video record.
Okay, could we mark the page that counsel showed the witness, please, as an exhibit? Thank you. Ma'am, did you happen, when the ambulance brings a patient into the hospital, do they prepare a report and either hand it to you as a triage nurse that you include with the chart?
Objection, foundation, and to form is in there. That was a compound question.
It's not always handed to the nurse. Sometimes it, you know.
When they do provide, when the ambulance person does provide it to you, do you keep it with the patient's chart?
Yes.
In this case, have you seen at least something that looks like a Maryland Ambulance Information System report?
Hold on, is it in your exhibit?
No, it's not in mine. It's, I didn't even know if it was in the packet that you showed her.
I don't think so. No, not that I can see.
All right. And my question is, have you, in this case, have you ever seen a legible copy?
No.
of- You anticipated my question, but it's
Sorry.
okay. Have you ever seen a legible copy of the Maryland ambulance report that pertained to Mr. Tolson's transportation to the hospital?
No.
Okay, all right, yeah. You said that part of your job did not require you to make any diagnoses, is that correct?
Yes, that's correct.
Okay, how do you define diagnosis?
A diagnosis is out of my scope of practice. It's the injury or the problem that is determined to be the cause of the pain or injury.
Now, your lawyer asked you questions that you are not, that you do not order consultations, correct?
Right.
But part of the triage, if I remember your testimony is, you have to consider whether a patient needs a consultation, correct?
Objection.
Yes, it's factored in
Right,
if you might anticipate that.
right. So you have to anticipate whether a patient will need a vascular consultation, correct?
Objection to foundation, and you're taking it outside of her scope
Yeah.
of
Tam,
testimony.
is that what you told me a few minutes ago?
Ask
early
the
on?
question.
Didn't you testify that part of your job as a triage nurse was to determine whether a patient may need a vascular consultation?
No.
I didn't say to determine. I might anticipate that the provider may order one, but it's not up to nursing.
Is
So-
that, let me go back again. I thought you said that a consultation would be an intervention, correct?
Yes.
And you have to determine from a triage standpoint whether you believe the patient may need an intervention, correct?
Objection.
But that doesn't determine whether they get one or not, if I anticipate they'll need one.
That wasn't my question. My question was, as a triage nurse view in this case,
Mm-hmm.
does your scope of practice require you to consider whether Mr. Tolson may need a vascular consultation?
Objection.
No,
Asked and answered. Go ahead.
it's not in my scope to determine if he would need one.
Is it in your scope to determine whether that is an intervention the patient may need when doing a triage?
Same objection. Foundation, scope.
I'm not sure I understand.
Right. All right, let's go back. Part of the job as a triage nurse is to try to determine the number of interventions a patient may need, because the number of interventions can change the priority level for the triage, correct?
Yes?
And you told me that an intervention, a consultation, is an intervention, correct?
Yes?
Okay. And do you not have to take that into account when determining what is the priority triage level you give to a patient?
Objection. Asked and answered.
Yes, so I did not, looked at, based on his presentation, did not think that he would need a consultation, although it is not in my scope to order one, but to predict as far as ER nursing and where we utilize our resources, then I did not think that he needed one.
Right. And you didn't think, based upon your assessment of Mr. Tolson, that he needed a vascular consultation, correct?
Objection. Asked and answered.
Yes, it's not in my scope, and as far as nursing care of a patient requiring that, I did not think that he needed the nursing care to support that.
Okay. And you did not believe that he needed an orthopedic consultation either. Would that be true?
Objection. Asked and answered. You can answer it again.
Again, it would only affect the nursing care of the patient if he needed a orthopedic consult, and from the nursing standpoint, I did not think that he needed one.
Okay. And from a nursing standpoint, as a triage nurse, you did not believe he would need a neurological consultation. Would that be true?
Objection. Same objection. Form and foundation. And you've asked and answered it, but you can answer it again.
Same thing. He did not have a neurologic injury, but again, only as far as the nursing care surrounding how many resources he would need so we could utilize our nurses better.
Does the scope of your practice as a triage nurse require you to describe a deformity that you observe on a patient's leg?
Objection asked and answered. You don't need to answer that again. You've answered it several times.
Okay.
Who prints out the forms, if you know that were used in this case for Mr. Tolson's medical chart?
I don't know.
Do you sometimes print them out yourself?
No.
No?
Mm-mm.
Someone else would have to do it first?
Objection. She's already said she doesn't know. Don't answer any more questions in that regard.
How did you get the forms to fill out? Where'd they come from?
Are you talking about this copy of the form or the
No,
actual form?
the blank forms. Where do you get them from?
The blank forms are in the emergency room. They're ordered by wherever they order them from, I don't know.
Okay, so you just go over and pick them up and
Yes.
then start filling them out?
Yes.
Okay, all right. Thank you. That's all the questions I have.
Okay.
That was the end.
Ms. Dinsmore, do you have any?
No questions, thank you.
Will read and sign.
The time is 1:09 PM. This is the end of disc number 1 and the end of the video deposition. We'll go off the video record.